आज ही oladoc ऐप डाउनलोड करें। oladoc, डॉक्टर का अपॉइंटमेंट आसानी से।
Hello, how are you? My name is Dr. Sahar Naved Khan and I am a dentist and an aesthetic physician. Today we're going to be talking about your basic skincare routine and what it should be. This is as important as brushing your teeth and everybody should know about this. Okay, the single most important thing in your skincare routine is your sunblock. SPF is extremely important and everyone should be wearing sunblock. There are different types of sunblocks available for different types of skin types, so you can always consult your doctor and they can guide you on which one is best for you. So what your skincare routine should be like from the beginning. So firstly, in the morning you should cleanse your face. It's very important. After that, you apply sunblock. You should apply sunblock every single morning. Even if you are indoors, you should still apply sunblock. Then when you're going outside, you should reapply sunblock. You can also add a moisturizer if you have dry skin. However, in the morning, a moisturizer is optional. If you do not have dry skin, you don't necessarily need to put moisturizer. So once your basic skincare routine is all set, that means you are already wearing a good sunblock, a good moisturizer and a good cleanser. You can move on to other things to help improve your skin texture. Vitamin C is really good for some patients. However, it does not suit some patients. So you can start vitamin C, but if it does not suit you, it is always okay to stop it. Vitamin C should most probably be applied in the morning. One very important thing is that when applying vitamin C, sunblock becomes extremely important. If you are not applying sunblock after wearing vitamin C, it is very much possible that vitamin C gets oxidized and it's going to make your skin look worse than ever before. Another thing that you can incorporate in your nighttime routine, which a lot of people do, is retinol. Now, always start with a very low percentage retinol and only start it once a week. When you initially are going to start retinol, there is going to be some purging. But retinol is very good to actually cause an anti-aging effect. So after turning 30, it is definitely a very good idea to incorporate retinol in your skincare routine. Another very important thing is that you should never use more than one active on the same day. So only use one type of active in one day and do not mix two different actives together. Another very important thing is that how often you are using vitamin C, retinol, niacinamide or any other any other active substance. It is very important to make sure that you're giving enough gaps in the middle. Also, it is very important after using any serum at night to complete your skincare routine with a moisturizer. This is called a sandwich technique. So the sandwich technique is really important to lock in all the benefits of it. One thing that you can always use, which is not an active, one serum, is hyaluronic acid. So hyaluronic acid is naturally produced in our body and that is what makes our skin soft and plumpy. So as you grow older, you start noticing that your skin starts getting more dry as compared to a baby which has a really soft and plumpy skin. That is because they have a greater concentration of hyaluronic acid in their skin. So incorporating hyaluronic acid as often as you can is actually really good for you and I would definitely advise everyone to do it. Thank you so much.
पाकिस्तान के टॉप डॉक्टर्स के साथ अपॉइंटमेंट बुक करें, वो भी पेशेंट फीडबैक देखते हुए। आज ही oladoc ऐप डाउनलोड करें। oladoc, डॉक्टर का अपॉइंटमेंट आसानी से।